Hey everybody, I'm Dr. JJ Thomas. Welcome to the Clinical Corner, where we use our clinical skills to help you get yourself better through exercises and recommendations. Today we're going to talk about hip mobility, and something I see all the time in patients that come to us is they come to us with hips tighter than tight, and they're like, oh my God, I stretch these things constantly. Why aren't they helping? Why aren't these stretches that I found online helping? They're not helping because oftentimes the deficit in the hip mobility that you have is because your foundation, your stability piece, your primal movement patterns, your foundational movement patterns are lacking. They're not synced up to your hip. And so therefore the hip will tighten down because, actually there's two things. Number one, the hip will tighten down because it doesn't feel safe. Number two, when you're stretching, if you're doing any type of like rotation or anything, oftentimes what you're doing is you're just pulling your whole pelvis with you. You're not stretching your hip, you're literally your whole pelvis. If I just show you in half kneel here, oftentimes people will try to get like a hip stretch and their whole pelvis will go with it. So you're taking the motion somewhere else. So these two exercises are going to prevent you from losing out on those opportunities where you can get better flexibility in your hips through a foundational stability piece. Here they are. The first one, this is simple but not easy, as most of the things we give are. So you're going to find yourself on this prone propped position. And when I describe this position to patients, what I tell them is, I want this arm front to back in line with your shoulder angle. Okay, so not way out here, not way back here. From this shoulder angle, front to back, I want the elbow directly in line with the shoulder. From a side to side position, I want your arms sort of angled like a pseudo diamond shape, like an incomplete diamond. So not all the way here because that's too much internal rotation on the shoulders, but just kind of an incomplete diamond like that, okay? Now, in order, I'm gonna go this way so you can see what's happening with my hips. In order to do this correctly, the first piece is I want you to push the floor away. Fingers are spread. My entire forearm is contacted on the ground. Something you'll hear me say a lot is input equals output, right? The brain has to take input in order to give an output. So the more healthy input we can give through the floor here to the brain about where our stability is in our thoracic spine, the better result you're gonna have here. So nice firm contact from fingers all the way to the elbow. Push the floor away so that your sternum caves. This is that foundational piece that I want you to integrate right here. Now we're gonna put hip mobility on top of that after you push the floor away, you're gonna hold that and you're gonna gently slide one knee up towards the elbow. You are not going to let your shoulder, let me do this. You are not going to let your shoulder cave. So pushing away, sliding that knee up, not letting that opposite shoulder cave. Because if I let that opposite shoulder cave, all I'm doing is changing my relative position of the spine and pelvis again. So if you really want to gain that true hip mobility, you have to keep the stability pattern what it is right here. Fingers spread, push the floor away, keep the shoulders square, slide one knee up as far as you can. It might be here. That's the hardest thing about all these exercises is being honest with yourself with where you are with good form and working through that. When you work through that, you will excel in your progress. So wherever you are is fine. Take the time to alternate each side. Maybe before you move to the opposite leg, you check the pattern every time. You check that scapular push and just do it like that. Just make sure. The biggest mistake I see is that people let that shoulder cave and they miss out on that true hip mobility piece. So that's the first one. The second one you're gonna do is in the quadruped position. It's very similar in that the foundational element of it has to come from the upper extremities. So fingers spread, elbows straight. I'm gonna do this kind of, actually I think I'll do this one head on to start. So fingers spread, elbows straight, shoulders are stacked over wrist. What I want you to do is slide one knee towards the elbow, and then if you can, keep sliding the foot all the way up. I guarantee 85% of you are gonna do this. And 100% of the 85% of you that do this are not gonna know you did it. So I want you to ask yourself as soon as you go to do it, first of all, tell yourself not to do it. And then when you do it, because you probably will, check yourself. All right, so fingers spread, elbows straight. Slide the knee to the elbow. If you can bring it closer, great. But do not lift that wrist. If you lift that wrist, you're essentially doing the same thing we were talking about, where you're just hiking out that pelvis and you're not getting pure hip mobility with foundational stability. So it'll look like this. I'm going to show a couple different avenues to a couple different angles. Fingers spread, elbows straight. Knee to elbow. If you can't get the foot any further, that's totally fine. Just go back. Do the opposite side. Maybe after 5 reps of this, you can essentially get the leg a little closer. Maybe you get it a little closer. Do not lift that wrist. The other thing I don't want you to do is that. You can't go out here, because then you're just feeding compensations again. It has to be a straight line path towards the outside of the wrist. I'll show you from one other angle. So we're here in this quadruped position. It's okay, right? In the quadruped position, slide the knee to the elbow. If you can go further, great. If you can't, you got to be okay with that. Sliding the knee. Stop wherever you can. Do not go out like that. So that's it. Give them a try. You should see an immediate change in the retention of the hip mobility work you're doing versus just stretching the heck out of it and seeing no changes. Looking forward to next time with you. If there's any specific skills or tools you need for a specific type of problem that you're having with your musculoskeletal system, please feel free to message us, leave a comment in the description, and make sure you like and subscribe us so that you don't miss out on any content. Looking forward to talking to you.